is the segment, so Network of Nurses, something that we're very, very pleased and just honored to do because I mean these are real heroes in our community and they deserve to be recognized. I know they're not seeking the limelight. They don't want the ancient Chamorro or the ancient order of the Chamorro award. They don't want a cookie. They don't want rewards or things like that. They just want to be able to do their job and they're very, very good. Actually, cookies would be a nice way to to recognize our nurses, and we have a very, very good one. Someone who's very happy to be involved. And it's not a business. It's I've heard nurses and Leonora Urbano, Hafide, and welcome to the link. We're so glad to have you here. And I've heard it's been said that nursing and its various disciplines and everything, it's not a job, it's a calling. I'm sure you would agree with that. Whoops. No, she's unmuted. You got audio? Okay, so thanks so much.
Yes, nursing is a vocation. It is very challenging and at the same time very rewarding.
Mm-hmm. Now, you are the psychiatric nursing administrator at the Guam Behavioral and Wellness Center. What exactly is your scope of responsibility?
Well, as a nurse administrator, my role is in leading a team of nurses and psych technicians and psychiatric technicians in problem solving the ever increasing and complex environment that we have in the healthcare setting.
Mm-hmm. Now, when we were setting up this interview and everything, like I saw your job title and forgive me if this is a naive assumption on my part, but I was wondering, I was like, are you kind of like almost like a staff psychologist? So you deal with like a lot of what the mental impact of nurses going, especially in the pandemic, because, we've talked to so many nurses and they said, previously they may have only intubated a couple of patients in a couple of years, and basically you have to put a couple of years in the field before you're able to do that. And some nurses are like, I intubate people almost daily now. They say the psychological impact of being able to know you're working on patients who are very, very bad when they come in, and many who tragically don't make it out. I mean, that has an effect on them. So is that almost kind of like what you do? Because I was thinking maybe like a police psychologist helps
No,
policemen with what they do.
I'm a psychiatric nurse administrator. That's my board certification, different from a psychologist.
Gotcha. Okay.
So in that role, it's also upholding the standards of nursing practice and evidence, and we implement evidence-based practice to the most that we can. And since you were mentioning about the pandemic, we had Guam Behavioral Health and Wellness Center had their fair share of crisis management. So to illustrate that or to elaborate on that, since this pandemic, Guam Behavioral Health and Wellness Center has seen a steady rise in our crisis hotline calls. Our 24/7 hotline number, by the way, is 647-8833 and 884. So in the outpatient setting, we are averaging about 10 to 14 intakes a day compared to less than 5 pre-pandemic. In our crisis stabilization units, our occupancy rate averages 80 to 85% compared to less than 50% before. We also have our share of taking care of patients in mental health crisis that are COVID-19 positive. So we had admissions. We don't reflect our numbers, though, in the Joint Information Center announcements. So with that, when we take care of patients with COVID-19, we also have a dedicated warrior team that are trained, mobile, and ready to be tasked at any time. So our isolation facility has been shared. We were sharing the isolation facility at Bayview.
So it sounds like yourself and the team that you run, you're very, very agile, very, very ready to go at a moment's notice, and you've got a very wide range of skills.
Yes, we do. I can tell you that just like any other health frontliner in the hospital, in the hospitals and even in the clinics today, that my staff have been overworked since this pandemic. I'm afraid that GBIC will be busy for the long term. I say this because based on recent studies, 1 in 5 of those who recover from COVID-19 reported and received treatment for mental health issues. That is 20%. Mm-hmm. We don't even get 20% in our income. So what more with the revenue of Guam? So that will impact us in a long term.
Yeah, Leonora, what types of mental health impacts come? Obviously, there's something with a high degree of stress, maybe anxiety, depression, and everything like that. What else do COVID-19 patients, on a mental perspective, what do they go through?
We do have first timers of psychosis.
Mm-hmm.
And
can you explain what that is?
Very different because it's not even drug induced. So it came all of a sudden. They never had history. So it is probable that is an effect of the coronavirus also.
Yeah, Leonora, would you be so kind as to explain exactly what that psychosis is and like what it does to the patient?
Of course. So when somebody is in acute psychosis, they cannot function because their thoughts are all disturbed. They hear voices that tell them to kill themselves or to be harmful to others. So that's the time they are admitted to the hospital, to the Guam Behavioral Health.
This is astonishing. I mean, and certainly this is probably an aspect of having to deal with COVID that not a lot of people in our community probably would have considered at this point. But you're saying, you know, one out of every 5 patients who is diagnosed goes through this. That is incredible.
Yeah, might. So also we also have an increase in drug-induced psychosis. Mm-hmm. So that's very worrisome too.
Okay. What can we as a community do to make sure that you can continue the good work that you and your team do? Because, you know, we support you completely. You know, we love and we cherish you guys for stepping up and for doing the job that you do. But, you know, is there anything that we can do as a community to help you and to make sure that you guys are doing the job to the best of your ability?
I think we cannot overemphasize the use of masks. If we can all mask, and especially the social distancing, your hand hygiene, your masking. I'm even telling my staff, even when you eat with your family, eat first, finish eating, put on your mask, and then talk and laugh. Because we can still have fun, but decrease the moments where you are not masked or not protected. Because when we protect ourselves, we also protect others.
Okay. Now, may I ask, you know, as a medical practitioner and someone with obviously a lot of years of experience, and, you know, you've got the training and the compassion and, you know, and the desire to do this kind of job. Again, you know, it's not a job. This is truly like, you know, not just a vocation, not just a job, but a calling. And what has the pandemic and what is working over the last 8 months, to the degree that you have and with the kind of patients you've seen, what has that taught you and with all your years of experience? What have you learned?
I would say that our staff, everybody at GBIC have a unity of effort. That's what I can say, because everybody stepped up to the plate. Even with the limitations of our PPEs before, even our civilian agencies have helped. They have donated PPEs pending our purchase of supplies, which were difficult to find. Our network of nurses have been very helpful. Guam Nurses Association have been very helpful. The management also have been very supportive of us, even with our dwindling resources. When I ask for additional staff, PPEs, even our modification of our air conditioning system, they provided that. And we are going to have our own isolation facility too.
Okay, well,
I'm happy to share that.
Well, Leonora, I believe there's one of your colleagues is joining us on Facebook in our comments right now. And Leonisa Beneventi says, for nurses, please give us fruit. Our A1C will rise. Please donate to the children of Guam. So, I mean, that is a great way that we can make a donation to contribute. Because, you know, if we give you the tools that you need to have energy, to stay strong, and to continue to fight on our behalf and everything, we'd be happy to do so.
Thank you so much. Food is always welcome, of course.
Well, it is social currency for our people and everything. So again, thank you for joining us today. It's been our honor to let the community know another aspect of what you do, and you truly are heroes on our island. We can't say thank you enough, Leonora. So to you and your staff, thank you, and Sidus Masi. Thank you so much.
Thank you so much, and have a good day.
All right, please have a wonderful day. Please stay safe.
For the latest in the world of wellness, health.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6
at 6 a.m. with The Link.